Hello everyone, I am Manali Reshamwala, Assistant Professor from LJ Institute of Physiotherapy. Today I am going to talk about cardiac resuscitation. It is a part of syllabus for physiotherapy in cardiopulmonary conditions for final year physiotherapy students of Gujarat University. Not only is a part of important topic as a syllabus, but is a part of very important thing as a paramedical staff we should be knowing. If we are knowing cardiac resuscitation, steps of it, and at least a basic life support of it, we may save someone's precious life. As this part has been very long, I have concluded in various parts of video tutorial. So in part we are going to see the cardiac arrest and introduction of cardiac resuscitation. Let's start with the introduction. The leading cause of sudden death in before old age in people over the age of 44 are the ventricular fibrillation from the asymptomatic ischemic heart disease or non-traumatic accidents such as drowning or poisoning. But in people under the age of 38, the commonest cause of death are traumatic due to accident or violence, and especially it is a tragedy in India. In such instances, death may be prevented by either if the airway obstruction can be reversed or apnea or hypoventilation avoided, blood loss prevented or corrected, and the person not allowed to be pulseless or hypoxic for more than 2 to 3 minutes, by which we can prevent death. If, however, there is circulatory arrest for more than a few minutes, or if blood loss or severe hypoxia may remain uncorrect, then irreversible brain damage may occur, which may lead the patient to go into coma. For such thing, we need to do immediate resuscitation to prevent brain damage and prevent death. The techniques required may be used anywhere, even at a roadside, even in a hospital, even at any garden or place where you find an unconscious patient who falls in a sudden shock, falls on the ground with either of accident or due to ischemic heart disease. Without equipment, or if we find any kind of equipment, it's a medical emergency. This resuscitation can be provided by any layman person or any medical person who knows the basic steps of it, so that appropriate training is required. The phases of resuscitation, there are mainly 3 phases of resuscitation. One is basic life support with little or no equipment required. Then second, when equipment and drug becomes available, we can give advanced life support. We can start advanced life support, which helps us to restore spontaneous circulation. And the third is prolonged life support, which is given in ICU care. And the main goal of prolonged life support is salvaging cerebral function in other aspects of intensive care. When we come across any unconscious patient, first of all we need to try to shake him and shout him to make him awake. After that we need to call for help without leaving that person. Either we can call 108 or any emergency helpline, or we can ask any person sitting around or roaming around us to call for emergency service. After that, we need to immediately check whether the patient is having patent airway or not. If it is not, we need to provide. The patent airway can be provided by tilting the head upward and opening up of the chin. If the patient, if we are seeing that during we are looking at whether the airway is patent or not, and if we see that patient is breathing, then if patient is unconscious but is breathing through the patent airway, then we should roll him in a stable side lying while face should be pointing downwards, so that any kind of vomiting or any kind of reflux getting can be removed easily, and it does not get inspired into the lung. The head should be tilted backward and jaw supported to keep the airway patent. In a case, if we are making a patient to lie in supine, then we need to turn the head upward and give thrust to the jaw, so that mouth remains open. As shown in figure B and C is correct way. We should not provide pillow which will obstruct the airway. Next, if the patient is not breathing, then what? If patient is not breathing, then while keeping the patent airway, he should be put on his back, that is on supine lying, and artificial ventilation should be started. That can be either from mouth to mouth or mouth to nose, or with the various other ways which we will see in detail in basic life support. Finally, we should check his pulse. We should check carotid artery for pulsation. That is the most preferable way. As if the patient is in shock, we may not find peripheral pulses, but we may find carotid pulse. If no pulse can be felt, then the patient, and if patient is also unconscious, then it must be assumed that patient is in cardiac arrest, and we require to give him cardiac massage. While continuing to provide artificial ventilation, we should also provide extra cardiac massage to maintain patient's circulation also. So we are giving artificial ventilation and we are giving cardiac massage to maintain circulation. This way we can provide ventilation and circulation to the patient, so that circulation will be provided to brain as well as, and we can prevent brain damage. What if we come across a patient who was already admitted to hospital? If we see the patient who is admitted to hospital must be under monitoring of ECG and all those things. So if we find ventricular fibrillation lasting for more than 30 seconds, that means patient is having cardiac arrest, and that patient should be immediately treated with defibrillator using 200 joule. Usually a defibrillator given can correct the cardiac rhythm and patient can be survived from cardiac arrest. But if that does not happen, we need to again start by maintaining the patent airway, giving ventilation and circulation by giving cardiac massage, and further we should try for defibrillation. The whole procedure can be understood in detail in my next tutorial, where I have described basic life support, advanced life support and prolonged life support in detail. But before that, what's ABC of resuscitation that can be understood? Can you guess that? Let's see what is ABC, that is basic life support, where A is airway, B is breathing and C is circulation. Next is advanced life support, where D is drugs, E means ECG, F means fibrillation treatment. Then prolonged life support, where G means judgment of whatever the outcome of basic and prolonged life support. Then H is human mentation, we should maintain the circulation regain and intensive care. So here is a reference from where I have taken. Thank you.